Ann B asks, what would an ideal healthcare system in the US look like? How would we get there from where we are now? What about people who don't have much money? Alright, the short answer is capitalism. Totally capitalism, absolutely no government involvement. What about people who don't have much money? Well, if you'd like to give them money, you're welcome to, and the same goes for everyone else. Like, you can give them money voluntarily, but they shouldn't get my money if I'd rather spend it on something else rather than their healthcare. There are limited resources in the world, and people have to prioritize, and it's up to each person to decide like what they want to spend their money on. If I create wealth, if I produce, then that's mine, and I get to decide like to spend it on my own medicine or on a better computer or whatever else I think is the best use of the money. And there are some charity cases where I think charity is important and a big deal, and if no one else was doing it and I didn't see a higher priority, I'd seriously consider donating. And that would be a case like a 15-year-old and their parents die, or they have really bad abusive parents and they have to leave home when they're 15, and they also don't have like relatives to help them. Someone like that where it's totally not their fault that they're in a bad situation. I have a lot of sympathy for that, and I think it's good to help them to sort of make up for what their parents failed at. And there are other poor people who are, they're poor because they're dumb, they're poor because they're irresponsible, they're poor because they're lazy. And, that is a very low priority charity case for me. I wouldn't call it like zero, like it's, perfectly nice to help people even if they're not especially deserving, but there's a lot of other things that I would see as a higher priority, so I wouldn't be interested in that. And it's not like the government does an amazing job of helping those people. Like, the government takes a lot of money and then does a shitty job of helping poor people and actually causes a lot of problems for poor people and creates some bad incentives and gets some people like trapped in poverty. There are ways the government is like creating ongoing poverty for people. Some of the stuff the government does is ridiculous. I don't want to get into it now though. I'm trying to focus on healthcare. So healthcare costs a lot more than it should because a lot of the money paying for healthcare isn't coming from the person buying the healthcare. It's paid for by someone else, like a government agent or like an insurance person is deciding what to pay. And they're not properly price sensitive in the way an individual watches out for his own finances. There's a great deal of inefficiency. And there's like way too much paperwork and crap, wasting a lot of money. And there's all sorts of regulations that get in the way of healthcare. Like the FDA like bans all kinds of drugs because it can't prove they're safe yet. And that's really silly. People should be able to like risk their own health if they want to. And there are perfectly good reasons to risk your own health. One is the safer drug doesn't exist at all. It's a risky drug or nothing. That can be a pretty good deal, especially if your condition is fatal. Another reason is if sometimes there's like a safer drug that's really, really expensive, and there's a much, much cheaper drug that, is less proven or has some risks. And, a lot of people don't have a ton of money and they don't want to ask for like tons and tons of charity. Like, why can't they just take a bit of a risk? There isn't actually enough wealth in the world to just provide the best of everything to everyone. Something has to give. Not everyone gets to have everything because we don't have enough of it. And that's one of the reasons that charity isn't like the biggest priority for me, is because I'd rather produce more, make the world richer, make more wealth in the world, help make things like way better. Charity is like consumption. It's like, you're giving money for them to use to make their life a little nicer. But I'm more interested in capital accumulation, increasing the productivity of labor, having better tools and factories and things so we can have like more medical machines for everyone to use. The price of medicine will go down when we're able to mass produce more stuff more cheaply. The price of medicine will also go down when our education system is better so we can more easily train more doctors who are more effective. So things like TCS, having people be better parents, having better education, working on improving the school system would help provide better medicine to more people. So that kind of thing is more of a priority for where I would want to spend my money than charity is. Like, we have to prioritize. Would you rather have a bunch of money go to make poor people, some of whom are irresponsible or lazy or whatever? Some are unfortunate, but a lot of them are there for a reason. Would you rather try to make their suffering a bit less, or would you rather try to make the world richer so everyone can have a better life, 20 years in the future? I'd rather look at the long-term thing and try to make society more powerful and help everyone more in the long run rather than help a few unfortunates in the short run. I'd rather build up more production capacity than spend some production capacity today on a few people who are in a bad situation. The FDA is like ridiculously bad too. Like, we really need a free market for deciding like which medicines are safe or whatever, and like we can have, like we have consumer reviews and we have Amazon reviews and we have all these different things like rating things and judging things. We have Yelp. We need that for medicine, and to have like a bunch of actual serious companies like deciding which medicines are how effective and which are dangerous and so on, and side effects and so on. The FDA is not good at that, and we need actual competition where different companies try to like outcompete each other at being reliable about it and getting a good reputation. Right now we just have the stupid government, so just to give you a sense of how bad the FDA is, they have this thing called a 2 studies policy, where if you can replicate that your medicine works in 2 studies, then they will say, good job, your medicine works, we approve it. This ignores the number of failed studies. If it's 2 out of 100, it still counts, even if the studies are to the normal like 95% confidence. So you'd actually expect it to work like 5 times out of 100 just by dumb luck, So they can just keep trying the same drug over and over, and it doesn't work, and it doesn't work, and it doesn't work, and then they get lucky on 2 studies, and then the FDA approves it. And that's so stupid. And it really is that stupid. Like, you can read about it. As far as how to get there from where we are now, just keep shrinking the government and getting the government to focus more on its proper role of defending men's rights and putting some control over the use of violence, so we just don't have like a violent anarchy. And just keep taking things the government does now that it shouldn't be doing and have it stop doing them. So that can mean things like don't expand Medicaid and start shrinking parts of it. Find parts that are unnecessary and like get rid of them. Find ways to have, phase fewer people into the system going forward, with an eye towards not bringing any new people into the system at some point. One of the current US proposals is like leave the Obamacare plans as options, but allow the companies to also offer other types of plans that don't have all the stuff in them that Obamacare requires. Because Obamacare makes like these very bloated plans where like single men have to get pregnancy coverage and stuff like that, and everyone has to get like psychiatry coverage. So allow like minimal disaster coverage plans just as options, and then people can choose which one to buy. And some people will choose like very minimal insurance plans that are actually insurance, because insurance is the concept of insurance is risk reduction. You take something that's like a low chance risk that would be really bad, and it's going to happen to say 2 people out of 100, and then 100 people pull their money, and 2 get unlucky and they get all the money to make up for being unlucky, and the other 98 people don't get any money, they don't get any services, they get nothing, but they didn't get unlucky. It was just in case they got unlucky, then they would have been helped. So anything where you're like, paying for routine services is not insurance. That is just like a monthly membership fee. A monthly membership fee is totally which pays for like a routine physical, is a totally different thing than insurance against a risky event like a disaster, like getting hit by a car. So just make disaster insurance legal and let people switch to it who want to. And some people will want to. They'll say, okay, so if I get disaster insurance, I will pay less per month. And then if I go to the doctor, I'll have to pay for my visit. And they'll say, I think that's a good deal, I'm going to switch, Let people do that. Give people more freedom.